So for people on the call, if you could mute if you're not speaking, that would be very helpful. Apparently I'm spotlighted. It says you should be able to see me. The recording has started for this particular stakeholders meeting, and I can now see the majority of people that are in the meeting. So I do believe we will get started. I do have 9:38 on my clock here. So welcome everybody to the stakeholders component of the Saskatchewan Oral Health Coalition meeting today. This is following our annual general meeting that just ended. And so welcome everybody. This is an abbreviated update compared to what we've had in the past, but we do have some guests who are going to be providing updates on their program areas, their areas of expertise, their professional updates, and updates that are applicable to basically just very interesting information related to oral health happenings in Saskatchewan over the past year. So if Dr. Rothwell is on, I don't actually see his name here, but if Dr. Rothwell is on, can you see him, Lena? I don't see his name here.
No, I don't see him on yet.
Okay, so he was one of the first speakers. Lena, do you want to, Kelly, does somebody want to check with him and see if he remembers he needs to have another, it's a different link he has to link into for this meeting?
I can send him an email if you want.
Okay. Kelly. Lena, I can't see whose mic is on or not. Somebody has their mic on. Okay, so sensing Dr. Rothwell is not here right away, I'm going to move down. I don't see Dr. Yazdani either. So I'm going to move down to Jared is going to be on, but he's not going to be here for a little bit. So I'm going to move to Megan Catcher, who can do an update for Indigenous Services Canada, please. Take it away, Megan. I think you have a slide.
Sure. Good morning, everyone. I feel silly going first, but I will do a quick update here. I'll try to share my screen. How's that? Not quite. Can you see my screen or slide?
No, we're just seeing you.
Just me. Okay. I'm having trouble with my second monitors here, so I'll just speak to it. I do have just one slide. It's not very exciting. My speaking will kind of speak to it, and it's just some bullet points. But my name is Megan Ketcher, and I'm the acting dental team lead. There it is. Thanks, Lena. I'm the acting dental team lead for Indigenous Services Canada for the Saskatchewan region. And just some highlights or updates from this last year. As some of you may have known, we were Indigenous Services Canada dental therapists were essentially the surge support for the federal government in Saskatchewan. Literally, we have just, as of a week and a half ago, taken off that hat. So it's been, it was a really crazy and strange couple of years, but it was also really rewarding. And I'm really, I guess, pleased to say that we definitely put dental professionals, dental therapists in particular, just because we're mostly dental therapists with Indigenous Services Canada, on the map as being really awesome oral health or healthcare professionals in general, not just oral health. So some of the things that we did was the nasopharyngeal swabbing. Many of us immunized for COVID-19 for adults. And then, of course, when pediatric vaccines became available in the fall, they were super excited to involve the dental therapists who ironically work with children a lot of the times. And so we were sharing our tips and tricks that we often use in our dental world practice right with dealing with kids. We also had many of our members do delivery of vaccine, because of course you may know that was not just like.
No, you're still on. Check over there, webcam, make an X on it. Go in the
Diane,
middle, down,
I think
down,
you're.
middle.
Do you mind putting your
And follow my directions down to the bottom of the page.
on mute?
But up a little bit, right in the middle. Go to the middle of the page. That right there.
There you go. So yes, some of our members also did vaccine delivery. We helped with the COVID data entry, which was a whole other world. And then one of our members basically did all of the PPE support and procurement of PPE for the pandemic for the entire region. So on the kind of programming side, we did continue. Hi, Parviz.
Good morning.
Do you mind putting your on mute? I'm just in the middle of my little presentation. Thanks. So on top of the COVID surge supports, then our team did continue to support our communities, virtually training old and new aides. We had lots of staff turnover. It was a really tricky time because we were technically only allowed to travel to community for COVID supports, not so much for programming of co-hire dental. So lots of learning with virtual supports and that sort of thing. We continue to support partners with any updated information on policies from national office, the best we could. Lots of making up oral health care packages and aides that we're working in the community to distribute them and try to still have that bit of a connection to COI until we could resume services. We were fortunate enough to have actually Dr. Sherry McKinstry as our consultant dentist for Indigenous Services Canada. It's been about a year now, and we really didn't start using her till kind of just before the end of this past fiscal year. So I guess February is kind of when we were given the green light. And she's able to go out to many of our communities to assess dental equipment inventory, really connect with the community, see what the needs are. Of course, I know in our AGM, Leslie had mentioned that she is involved in IDAC, the Indigenous Dentistry of Canada. So, really a good advocate, I think, for Indigenous, and we're really excited to have her on board. So yes, she's kind of started with us. As of May 5th, we were given official approval to resume travel to community for COHI and dental. So we're super excited, and some of our team went out literally that day that we got approval to go. So we're into doing back to in-person training, cleaning our clinics, ordering supplies, getting everything ready for hopefully a quote unquote normal September for sure, because the summer is sometimes always a little bit rocky with different events and stuff going on. And yeah, we're really excited to resume services, but we are mindful and cautious because we did such a good job in the COVID support surge team that we may need to pivot in the fall depending on how things go. But that is my update from ISC.
Okay, thanks, Megan. So I see Dr. Yazdani is with us now, so we're going to move back up and have Dr. Yazdani do a bit of an update for us on the Saskatoon Tribal Council bus and any other federal dental plan, anything else he'd like to discuss. Dr. Yazdani, take it.
Good morning, everybody. Yeah, so as some of you may be aware, approximately a year and a half ago, we entered a partnership with Saskatoon Tribal Council, and with the objective of providing dental services on the 7 nations within the Saskatoon Tribal Council. And the task of organizing the dental portion of this venture fell on me, and that was great based on the experience that I'd had before. This was an excellent opportunity to translate and transfer some of those experiences over. The idea was that they took a tour bus, like a music tour bus, and they converted it into a mobile health center with the emphasis on mental health and dental health. And the way they did this was by providing the basically a driver partnership with Medivie Canada also, and funding from federal and provincial governments. And the idea was that the bus would go to each community. The details, mechanics, and logistics of it were to be worked out and discussed and decided in due time. But and really mostly as a matter of trial and error. So long story short, the bus was converted, and we turned the back of the bus into a one-chair complete dental clinic with all the COVID protocols in mind, because we were in the thick of COVID at the time. Not that we're quite out of it yet, but it was timely so that we can make those provisions in the design. And we hired a team that would serve on the bus, and we decided to have it and design it from the ground up to the extent that we could with the latest technology, including all the digital technology that would allow good and proper communication between the team on the bus and us on the ground here, because they would need consultations and things to run by us, that kind of thing. And so on the bus, there is satellite internet, and we have digital x-rays, we have dental software that's all digital. So it allows us real-time access and collaboration. And we started by taking the bus to each of the communities every day on a 7-day rotation. And soon we realized that that wasn't the most efficient way of doing things, because we would lose momentum as we started working. And on top of that, there were days that the bus couldn't go for a variety of physical reasons, whether it was road conditions or weather or something that was happening in the community that wouldn't allow us access. If there was an event going on, the bus would normally throw anchor at the school. So if there were events at the school, or if there were no students at the school, that would affect our schedule. So since then, we have changed things around so that we would go to each of the communities for 1 week. So it would be a 7-week rotation as opposed to a 7-day rotation. And that has worked out quite a bit better, because in each community we can build a bit of momentum before we leave, and that has been good. It has worked out well. There are still kinks to be worked out of the system, but the interesting thing about the whole thing is that this is the prototype for future healthcare to remote communities. So we have a lot of eyes on this project, both from a government and political vantage point and from healthcare vantage point. And the idea was that it is, the theory behind it has been that it is more efficient to take the service to different communities than to have all the members of the communities make the drive and to strain the healthcare dollars and funding for each community. So to that end, we are collecting data. We're keeping track of billings. We're keeping track of number of patients we see, amount of work we do, the types of work we do, all of that. And we're hoping to eventually, after the first 2 years, come up with a model that can be applied. From what I understand, there are 4 more buses in the works to provide similar services across the province. I can't confirm that officially, but that's what I've heard. So there's room for improvements on future projects. And with the recent announcements of a federal component to healthcare, dental healthcare on a national basis, there are opportunities to provide services along the routes. So as the bus is making its way to a given community, it can potentially make stops along the way in other smaller rural communities. That's at least a theoretical plan in provision. We're working on that. And remains to be seen how the federal plan exactly works out, because currently there's a bit of negotiation going on between the provincial bodies and the federal bodies, with the provincial government asking for the funds so that they can fund the existing infrastructure for dental care, and the Fed saying that they want to reach directly to the healthcare providers. So we'll see how that works out. It's delaying the launch of the whole thing a little bit. We don't know how it's going to settle up eventually, but that will have some impact into how things play out moving forward. In a nutshell, it's like all new projects. There are learning curves and trials and errors and pains and learning points, but so far it's been very good. And the staff that are working, the team that are on the bus, are finding it very fulfilling. We're extremely lucky to be able to recruit an all-Indigenous team, which would go a long way in providing a certain level of trust to start with and building those relationships. A lot of these communities have had bad experiences with mobile services in the past. Some of them have had bad experiences with dental services in schools, things like that. So we have a little bit of the preconceived notions to fight in all of this. But so far, so good. And that's it in a nutshell. I don't know if anybody has any questions or concerns or suggestions or advice.
We still have to have our meeting, Dr. Yazdani.
Yes. So on that note, just again to add to the update, for days that the bus can't go on the road, the principle with the bus was that it would primarily and mostly provide services to Indigenous citizens who have a treaty card. And so when the bus couldn't get on the road, the idea was to go and drop anchors in certain parts of the city, including some core neighborhood schools, correctional facilities, and other community centers. And so one of the things that we have found is that there is areas of overlap of services that require maybe communication at the other end of it. And when I say the other end of it, we are dictated by where the Saskatoon Tribal Council asks us to go. And on a couple of schools in the city, we found that there are already some services being provided by other groups. So we need to work out those redundancies and making sure that there aren't too many overlaps, just so that the most amount of services can be given most efficiently.
Does anybody have any questions for Dr. Yazdani?
In case anybody is wondering, I lost my hair to a bet, literally. So, non sequitur.
Okay, thank you very much for your update on that, Dr. Yazdani. I really appreciate that, and it's really good information for everybody to be aware of. So thank you very much for that. Okay,
You're welcome. Anybody who has other questions can feel to reach out directly to me. Thank you.
Okay. So we're going to hopscotch around a little bit on the agenda just based on people's availability today. So I am going to go down now to the Saskatchewan Dental Hygienists Association, and Alyssa Boyer is going to be reporting for the Saskatchewan Dental Hygienists Association. Alyssa, can you take it away, please?
Hi everyone, my name is Alyssa Boyer. I resumed the position of Deputy Registrar March 1st. So it's nice to see some names I've heard before, and I see a few familiar faces and some new ones. So it's good to meet you. So I'll give you an update on behalf of our Registrar CEO, Shelby Ham. She is in transit right now. She's on her way to Toronto for Federation meeting. So you might see her name on the call, but she's in transit right now. So So we'll get started here. As you know, the mandate of the SDHA is to ensure the people of Saskatchewan receive safe and high quality dental hygiene care and expertise from a continually advancing dental hygiene profession. We fulfill this mandate through our commitment to upholding the standards of the dental hygiene profession. At this time, we have 694 registrants, 616 of which have a full license, 45 have a non-practicing license, and 33 registrants have a conditional license. Over the past year, we continue to publish updates to the SDHA COVID-19 interim protocols through advisement with the appropriate authorities. We also published a position statement on orofacial myofunctional therapy to ensure our members that are delivering this care have obtained appropriate education and are aware of the limitations of scope. More time and resources have been dedicated to the complaints and investigative processes, both by the SDHA staff and our professional conduct committee. Registration and licensing processes and currency and continuing competency practices continue to consume our time to ensure that we maintain the highest standard of care possible. Significant time has also been spent in our office modernizing the processes of our organization so that we're able to function in the current landscape of today's world. In April, we hosted our 6th annual and our 2nd virtual conference and AGM for our members. We had approximately 200 registrants attend, and we are happily forecasting for an in-person conference to resume in the spring of 2023. This year, we've also been working with government to address legislative barriers found in the Dental Disciplines Act. So there is work being done to update our regulatory bylaws to allow removal of Section 25 and just increase the responsibility of oversight to the profession of the SDHA. The Discipline Committee is also in the process of preparing to host the SDHA's first ever discipline hearing. This will be held virtually and is open to the public and the membership. We're happy to report, well, I shouldn't say we're happy, but health promotion activities within communities have been an obstacle during the COVID-19 pandemic, but we've still been able to continue donating oral health supplies to those in need throughout Saskatchewan. We're happy to report that we're now seeing our members get back into the community to give presentations and to connect with communities once again. In March, we launched a Find a Hygienist tab on our website, similar to the regulatory bodies for dental hygiene nationally, along with other provincial healthcare professions. We now publicly share licensor information, and this was always made accessible to the public, but it is just now available electronically. And I don't want to steal Saskatchewan Polytechnic's thunder, but we're really pleased that they hosted another health and wellness day event on campus on March 26th and did a whopping $43,000 worth of dental services. So I was pleased to volunteer as a provider for that. And I'm pleased to be on the planning committee for the health and wellness day that we're planning to take place up in the north again this fall. And that is all I have for you today for the Saskatchewan Dental Hygiene Association.
So thank you, Alyssa, for that. Any questions for Alyssa? Okay, if not, thank you very much, Alyssa. We appreciated that update. And now again, we're hopscotching around as people are available. We're going to go back to Dr. Doug Rothwell, College of Dentistry, for his update. Thank you, Dr. Rothwell, for coming back online for this meeting. Thank you. Oh, you're on mute.
Thank you. I'm at home today, sick as a dog, and so my apologies. I missed the right time for showing up, and but I'm happy to be here now. Let me see if I can share my screen. Hopefully that will work. Give me one sec. I got to go into presenter mode. How's that? I assume that you're able to see my screen?
Yeah, it looks really good. Thank you.
Okay, great. So remind me, please, I can take 20 to 30 minutes.
Yeah, you have half an hour if you need it.
Okay, excellent. So thanks everybody for the opportunity to come and talk about the new dental therapy program, which is pending still. I'll give you a few details today. I'll try to go through it fairly quickly, and then I'll give you the opportunity to ask any questions or make any comments you might have. Just you'll see from this first slide that the dental therapy program, as planned, will be a Bachelor of Science program, Bachelor of Science in Dental Therapy program, and that there are 4 partners involved in the delivery of the program. In the order that they got involved in putting together the dental therapy program proposal, Northern Intertribal Health Authority, NITHA, the College of Dentistry at the University of Saskatchewan, Saskatchewan Polytechnic, and Northlands College. All 4 partners will play an equal role in the operation of the program going forward. Let me go forward with a few details. I'm going to talk with you a little bit about, as soon as I can get my slides to move forward, there we are. I'll talk to you a little bit about some of our planning assertions. I'm going to give you our mission, vision, and values. I'll talk to you about what the student body will look like, how the program is organized, a little bit about the educational model that we're using and the educational content, and then just a few quick words about accreditation. So first of all, a few planning assertions. So right from the very beginning, when we started planning this, by the way, this is many, many years in the works, 5 years for me back at University of Saskatchewan, but for NITHA and the college before me, several years before that. So we put together a few assertions for what we were planning with this new program. So number 1 was that the focus had to be on the population health, not on the professional dynamics and preferences of the different oral health professionals. And we decided early on that the best model for this program would be Indigenous providers working in their home communities or communities similar to or close to their home. And so we've pretty much avoided any influence by any of the professional bodies. Number 2, we've decided early on we're going to avoid the all or none model that is present in all of the dental health professions. By that I mean, when you go into dentistry, dental hygiene, dental assisting, if you don't complete the whole program, you get nothing. And you leave and you have no abilities that are marketable and no employment opportunities. So instead of that, we've set this program up to be a multi-entry, multi-exit model so that we can meet the many needs of learners, including our Indigenous student population that we're targeting. Because anybody who's worked in some of the Indigenous communities knows that there are many factors that get in the way of a prolonged period of educational studies, and so our program is set up to cater to that. We've updated the former educational healthcare model that was used in the previous dental therapy program. We're using much more modern equipment and methods, and we are training in a clinical team approach. So we don't think it's appropriate any longer to have one health professional in an enclosed room with a child, with a minor. We don't think that meets modern educational and healthcare standards, and so we are training as a team. And finally, lots of problems nationally on recognition of dental therapy credentials, as everybody knows. And one of those problems was the fact that the program was never an accredited healthcare program, and almost no other provinces recognize non-accredited healthcare programs. And so by having this an accredited program, we hope to avoid that and to give a pathway for national, for the ability to be licensed in multiple provinces or different provinces. So on to a few details. Our mission. The mission of this program is to develop the ideal workforce to meet the oral health needs and aspirations of Canada's Indigenous people and communities. Our vision with the program is to show the world that an educational program can be a catalyst supporting decolonization through respect, inclusion, empowerment, and the vitality that comes from personal and community well-being. So we are not only training dental therapists who will help with oral health care, we're also training people who will return to their communities, bring their income back to their communities, add to their communities, be those trained professionals that can help out in the community in committees and all of the things that all communities need to be vibrant. So we see our vision as more than just fixing teeth and doing dental health care. So what's the student body going to look like? Well, the Bachelor of Science program will limit admission to Indigenous students, if we can at all do that. We'll only consider non-Indigenous students if we have an insufficient number of qualified Indigenous students. The program will be a direct from high school program. Of course, we have mature student criteria. I won't say anything more about that. We give extra credit for mature students, but the core training that people will have to apply will be high school. They'll have to graduate with a minimum 70%. Our mature students are only 60. I'll just mention that quickly. But otherwise, minimum 70% average. And you have to have grade 12 English, biology, and math, and one other grade 12 course in the social sciences, humanities, or other sciences like physics. Our intake, the student body, will be 21 students a year into the program. Now, this program will be funded by Indigenous Services Canada. And as a nationally funded program, it has a national focus. And so we are looking to bring in, of the 21 students a year, 12 of them will be from out of Saskatchewan, OOP, out of province. 9 of them will be from Saskatchewan. And so we're hoping to help meet the needs across the country. We are promoting student sponsorship. It's an important part of having people go back and work in their own communities. And so eligible agencies that can sponsor students will include First Nations and Inuit communities, any Indigenous government or organization that allows Métis organizations to sponsor students as well. Any level government that has positions that they need to fill can sponsor students, and any regional health authorities. So we've kept it quite open to meeting the needs for dental health care. We've kept it closed to organizations like dentistry or dental hygiene or any others like that, because this is about the population health. There is a sponsorship process. I'm going to take the risk of clicking onto this. I don't know if it changed to where I want. Let's see if I can just put that up there. So this is the University of Saskatchewan sponsorship system. And so we are not creating anything new. It's a standardized thing that we use at the university. And there is a link here for the applications, just so you can see. It is a very standard sort of application process. Now I will pull that out. Hopefully I'm back on my slides. We have created a return to work agreement. Now, the return to work agreement will not be with the university or any of the other partners. That return to work template, is for use by different agencies so that they have agreements in place with the students. And you'll see in a bit, those students will get priority for admission. So what is our educational model? Well, you can see that our intent here is to take students, anybody that's graduated from grade 12 with the admissions criteria, to put them through 6 terms of educational programming, which is what's required to do a Bachelor of Science. That's a 3-year Bachelor of Science, and graduate every single student we bring in as a dental therapist. That degree, the Bachelor of Science in Dental Therapy, will be given by the University of Saskatchewan. Now, rather than it being 3 typical academic years, like is done with all of our other programs. This will be sort of the equivalent of an executive program, with students going 3 terms in the first year and 3 terms in the second year. So that allows us to run this as a 2-year Bachelor of Science degree, because it's the equivalent number of educational credits as a 3-year program. Now, I've already mentioned the multi-entry, multi-exit. We're aware, and we know from the history of the former National School of Dental Therapy, that a number of students aren't able to complete the program and go straight through from the beginning to the end in a single sitting. Some of them withdraw from the program and never return. So we know that's an issue that we're going to deal with. And so we don't want those people to leave with no educational value from what they've done. So we've set up a few exit points. So any student that has completed 1 term, we will have all of the content, the educational content in there to allow that student to leave as a dental aide and get a credential from Saskatchewan Polytechnic that allows them, that recognizes their training. They'll be certified to do infection prevention and control, sterilization, and we are just in the midst, our Sask Polytech partners are just in the midst of ensuring that the abilities to be able to work as a COHI worker are included in what's taught in that term. So they'll be able to leave as a dental aide. Any student that is able to complete 3 terms of the program, in other words, the first year, will be eligible to leave with a dental assistant certificate if they decide to withdraw from the program for any reason. There will be a co-op placement that's required out of here because of accreditation requirements for dental assisting, but we will ensure that the curricula are aligned so that the dental therapists get all of the curriculum materials that they need to leave as a dental assistant. Now, any student that leaves early, for example, I'll give an example that's I've seen in my own career, a death in the family, and all of a sudden a student who was formerly studying is called back to their family to be the primary caregiver. And that might happen for a year or 2. That person would be able to work in their, with their new credential if they had gone long enough to get either of these credentials. But then 2 or 3 years later, when the situation changes and they're able to go back to school, they're able to re-enter at the point above the credential that they received. So dental aides could come back and enter right into term 2. The ones that left with a dental assisting certificate come back and just enter into the second year of the program. Now, I also, sorry about the sore throat. I also mentioned that we know there will be some students who exit the program and decide that they'll work as a dental aide or a dental assistant, for their entire career. And so we know there will still be some open seats going into the start of the second year. And so to ensure that we graduate the number of students that we want to graduate, we are looking to take any registered dental hygienist who has completed a accredited dental hygiene program in Canada. We'll put them through a prior learning and recognition assessment and then do a bridging module that's individualized for the dental hygienist to get them ready so that they can join into the second year of the program and complete 3 terms to leave then also with a dental therapy credential, the Bachelor of Science, which would be from the University of Saskatchewan. Now, we know some hygienists have taken restorative modules and some have not, but all of them probably need the operative modules. And so that'll be what the bridging module is made up of, is filling in the operative dentistry and pediatric operative dentistry, things that a dental therapist does. Okay, so that's our multi-entry, multi-exit model. Let me show you how we now plan to bring students into the program. So we have set up a series of 6 different streams by which we'll bring students in. We will start with the first stream, and with any luck, we'll be able to fill the program with it. So starting in term 1 of the very first year, our hope is to bring in students only from stream 1, which will be agency-sponsored Indigenous students. So those are Indigenous students who are under a return to work agreement to go back to their First Nation community or Métis community or Inuit community, excuse me, and work in that community. Now, if we are unable to fill 21 seats under that stream, then we'll open up stream 2 and we'll bring in non-sponsored Indigenous students. So our hope is between those two streams, we always have the program full in the first year of Indigenous students. Only after, if we haven't got a sufficient number of qualified applicants, would we open it up then to non-Indigenous students. But the program will be filled with 21 students every year. Stream 4 is the returning students. So I've already mentioned that. Students who leave with a dental aid certificate can return into term 2. Students who leave with a dental assisting certificate can re-enter in term 4. Any additional open seats will be filled through stream 5 or stream 6. Stream 5 will be Indigenous dental hygienists, and stream 6 will be non-Indigenous dental hygienists. And we do anticipate that every year the program will be full, both in year 1 and then in year 2, and we should be close to graduating a full cohort every year. As for program organization, hopefully you can get quite a bit of that out of this org chart. You can see that the overall leadership of the program, dental therapy, BSc and dental therapy program, is a shared responsibility between the 3 leaders, Northlands College president, the Dean of the College of Dentistry, and the Dean of the School of Health Sciences in Sask Polytech. There is no particular order to these. It is an equal leadership role. But that leadership will all take place through an assistant dean for dental therapy that we expect will be a dental therapist. Of course, we haven't hired the faculty yet, but we expect that the assistant dean will be a dental therapist, and that dean will be responsible for 3 campus sites. So we're going to not operate this program out of a single campus. We're going to do it in 3 campuses so that people, our students, can learn in an environment most close to what they're accustomed. So for those who live in the south, we hope they will be in the Regina site. For those from mid-Saskatchewan, they'll be in the Prince Albert campus site, and those from further north will be in the Larange campus site. The Regina site is Sask Poly. The Prince Albert site is the University of Saskatchewan, and the Larange site is Northlands College. Now, every one of those sites will have 2 full-time dental therapist faculty members. They will have 1 full-time dental assistant who will support clinical operations, and they will share a coordinator for the dental therapy program. These numbers are arbitrary. It'll be 1 person who helps coordinate things, does marks, coordinates student support, all of that sort of thing. In each campus site, the students will be supported both by all of the supports available to any other student on that campus site. So Sask Poly students, whatever other Sask Poly students get in Regina, that's what the dental therapy students will get there. Same thing in Prince Albert with USask, and same thing with Larange at Northlands College. So they will get all of those student supports. Now, in addition to that, our NITHA partners are providing student wellness support as well. NITHA is a provider of healthcare professional health and wellness and mental health services. And so they are making those services available for our students as well. And they will liaise both with the coordinator and then also with one of our committees. And of course, being an educational program, all decisions are made by committee. So we have 3 committees: a clinic operations committee, an academic affairs committee, and a student wellness committee that pretty much will make all of the decisions, working through the assistant dean for the operation of the program. Imagine the very first year that we offer this program. There will be no students that will be going through from first year to second year, because there are no first year students yet in the very first year of operations. So to have the program full in its very first year for that year only, which by the way will start September 2023, we will take in 42 students in total. 21 of those will be the high school graduated students that we already mentioned. Okay, and for only the very first year, we will also bring in 21 dental hygienists who will be able to enter the second year. Of course, if we can find 21 hygienists interested in the program, we hope we will be able to. So the program will have a graduating class in its very first year of operation. Quickly on to the campus sites, just so you can see, this is the Prince Albert campus site. This is the new University of Saskatchewan campus. I'll just point out this round rotunda in the middle of the slide, because when I go on next to the floor plan, you can see the round rotunda right there in the middle of the building. This is a 3-story building, but on the first story, there is a dental clinic situated right here. I'll just go a little bit closer. So here's that green dental clinic right on the first floor. Straight out the doors to the left here is the parking lot for patients. Prince Albert City of Prince Albert's been kind enough to give us dedicated space for the patients who come in. You can see we've got ceremonial smudge areas and student support areas and lounges all available for this campus site. Quick look at the clinic. So we've got 4 open operatories, but with no patients being able to watch the care of other patients. We have 3 enclosed operatories. You can see it's nothing but the most modern ADEC equipment, including all digital radiography. We've got a Panorex, all the other things that are required in a modern clinic here. In Regina, this will be one of the Sask Poly campuses. And of course, here's the floor plan for Sask Poly's dentistry related, oral health related training program. So very large clinic, 7 chairs out of this will be used for the dental therapy program. And again, almost identical equipment to what we have at the Prince Albert campus, ADEC chairs, same cabinetry, almost everything. They've got enclosed operatories, so very similar. And I threw this slide in just to show everybody the quality of the new clinics and everything that they renovated at Sask Poly. I wish our stuff looked this beautiful. Anyway, very good facilities down at the University of, at Sask Polytech's campus in Regina. For Larange, I wish we were in this building with the big boat on the roof, but it's a different building of Northlands College. We don't have any equipment. This has to be built, but it's on the first floor of one of their campus buildings right in Larange. And of course, our reception area will be here and our clinic will be over here, classroom straight across the hall. So everything nicely together in a single space. And we have our grant includes sufficient revenue to populate this clinic with all the equipment and everything and renovations that are needed. Now, with regard to what we're going to teach, this is just a screenshot of the scope of professional practice for dental therapists in Canada. And so it's just to remind me that our intent is to train to the original scope of practice of dental therapy, because dental therapists, we all agreed, have been the ideal type of healthcare provider for the populations that we're targeting. To be accreditable, you have to have defined competencies of what you're training in any educational program. So we have developed these. We actually built upon competencies that were, with permission, that were originally developed from the Canadian Dental Hygiene Association's work. We've changed it to match our intents, but basically there are 9 areas of competency put into 3 larger sort of piles. So one being just knowledge of the discipline. So that's the foundational knowledge that you need in order to be a dental therapist. The core competencies that any health professional needs, like professionalism, communication, decision-making, leadership and advocacy, and then some very specific dental therapy competencies in clinical therapy, oral health education, and health promotion prevention. Each of those competency areas has been expanded out to a description of what the competency area covers. And so I'm not going to read any of those, but there are the 9 areas of competency. Each one of those then, so here's the clinical therapy one, has been further expanded out into competencies so up to the end here, it's about 30 different competencies in the clinical therapy, but about 2 or 3 pages of examples of how a student can show that they're competent in that area. So that's been developed for each of the 9 areas. We took those and we put it together into a 6-term curriculum that will be delivered over 2 years, 32 courses in total, but a different educational model than what's used in most dental programs. We're doing very much a spiral curriculum model. So if you look at these courses, you'll see that some of these courses, it looks like the same course runs 6 terms. Well, in term 1, we teach in each course, we teach at the introductory level. At term 2, we get a little bit higher. Term 3, we get a little bit higher. And by the time we get to term 6, it's all about the, the synthesis and judgment and application in unique situations. Whereas back here, it's, what are the facts, ma'am, sort of thing. And so it's a spiraling curriculum that ensures that students learn what they need to know appropriate for their level in the program. So each of those courses then, so this is one of the courses, has been fleshed out into what are the topics that need to be taught. We actually did this as a reverse initiative. We looked at what the therapists need to be able to do to be deemed competent when they graduate. So then what do they have to be able to show us in term 6? What do they have to be able to do in term 5 to do what they have to do in term 6, and so on down to the basic knowledge sorts of things and hand skills down in term 1. So this has been, the topics have been expanded for each of the courses. Course outlines have been given for each. We've got the learning outcomes all determined. We've got the competencies that are being taught to, and the way that the evaluations will be done, whether it's exams, written exams, OSCE type of exams, assignments, clinical experience, etc. Okay. I already mentioned that we are going to get the program accredited. There are 2 really good options in Canada. CDAC, the Commission on Dental Accreditation of Canada, which is what does all of the accreditation for dentistry, dental assisting, and dental hygiene. We've made the decision to go with Accreditation Canada instead. Their accreditation program is called Equal. It is an internationally recognized accreditation program, and we've already submitted our materials and our competencies to them, and they are ready to proceed with accreditation as soon as we send the paperwork off to them, which, by the way, has all been completed. This is just form 1 out of about a 20-form process to get accreditation, so we're all ready to go for that. We have set up our entire system to ensure that the educational quality management never falls below any minimum standard. And so we've got in our checks and balances to ensure that the accreditation, to meet accreditation and to ensure that educational quality stays high. Because it's a 3-campus model, communications is going to be very complex, and so we have put together a communication strategy that will ensure that that works out appropriately. We're going high tech with this program. So this is a slide showing the newest dental simulator. This is a haptic simulator. So you can see the handpiece sitting there. But when the student is working on the teeth, they're not actually drilling into the teeth. It's a haptic, so it feels like you're drilling into the teeth, but there isn't a handpiece at all. But the student looks through a virtual reality viewer, and to them, what they see is a burr in the tooth that they're working on. And I've tried this simulator. You can tell the difference between enamel and dentin with the haptic feel. So it's very high fidelity, very effective training, and it allows students to use a mastery level approach rather than drilling their one tooth and then asking an instructor, how did I do, and finding out it's really, it's not good or it is good. This computer will give them the feedback that allows them to practice sufficiently to get their skills up to where it needs to be. Now, our expectation is that we will have 5 or 6 of them for the 3 campus sites. And so should work very well. And the various campus sites will use the simulators for other students as well. Now, having said that, the majority of training will still be with standard typodonts or dentiforms, depending on what you're accustomed to using. And so our model in the 7 chair clinics, we do not have any preclinical setting. So the 7 chair clinic, the chairs will each work as either a preclinical setting or as a clinical setting. The students in first year will be primarily preclinical. They'll strap their mannequin into the dental chair. And so you'll see that they alternate Monday, Tuesday, Wednesday, and Thursday. The students alternate between being in the clinic twice a day and then once a day where they're in the classroom, to the next day they're twice a day in the classroom and once a day in the clinic. And so they alternate that way. You'll see that we've got the clinic set up so that there's 3 sessions a day. Morning is pediatrics. First 2 sessions are pediatrics. 3rd session is after school is over. And so that will be more the time where adults are treated. With that, I will stop sharing as soon as I figure out how to do so. There we are. And I now have 4 minutes that I can take any questions that anybody might have. I should, just one last thing before I take any questions, watch the media tomorrow. That's all I'm going to say. Watch the media tomorrow. There should be something that will interest people. And I'll open up for questions, Madam Chair.
Megan, you have your hand up. Go ahead.
Thanks. Sounds good. It's super exciting. Really quick question. I'm echoing. It's bothering me. There we go. For the entry for the first year, because it is different, like you mentioned, when you are going to accept 21 dental hygienists for that last 3 terms, is there any mention about, I understand that Indigenous will likely take precedence for qualification, but what about out of province? Are you taking into effect as well that same like spread of ratio throughout the whole country, not just Saskatchewan, right?
Yes, we're accepting applicants from anywhere in Canada. We're not giving special consideration to Saskatchewan candidates, but we anticipate there will be some Saskatchewan hygienists interested, I hope.
Yep. Okay, no, for sure. I just was curious about like the cross. I sit on lots of national boards and there's lots of rumblings that they're, like you mentioned, you don't want to make sure that it's very national representation. Okay, thank you.
You're very welcome. And by the way, the national is not an easy thing because dental hygienists in some jurisdictions won't be able to go home and be licensed as a dental therapist at this time. I mean, they can always work on First Nation and do so, but in some jurisdictions not. So part of this is a building thing in the future. Once we have an accredited program, then there's the opportunity for organizations like this one and for our Dental Therapy Association to lobby nationally for recognition of credentials and registration and everything like in, like our jurisdiction.
Very good. Thank you.
Cindy, go ahead. You had your hand up.
Well, I think you kind of answered my question when I was talking about hygienists coming from across the country. I, of course, get a lot of phone calls about hygienists coming across the country, and in some provinces right now, and I'm not sure how far into the future, but historically, they haven't been able to practice, of course, in Ontario and Quebec. And Ontario is where I get the bulk of the dental therapists calling, or dental hygienists calling me to take a dental therapy program. So I think you kind of answered my questions.
If they're not able to license in Ontario for a few years, and we had Ontario hygienists come here, they may stay in Saskatchewan and be interested in practicing here, at least, for the few years it might take to get that in place. Might be.
And you're going to go down the criteria again where those hygienists would first meet, if they're sponsored, First Nations, kind of the same criteria as you go through?
No, we don't have the sponsorship requirement for the dental hygiene. So yeah, again, it's our agreements. So you have to remember, NIFA is an important partner of this new educational program. And our agreement with NIFA, they were a big part of putting together how we're going to do it. And the sponsorship idea came from from the discussions with them, but they were mostly interested in the first level. They didn't feel they had a lot of hygienists, community members that were hygienists. And so that was not something that they targeted. And so we've just made life a little bit easier by just saying, we are going to give priority to Indigenous hygienists, but after that, any hygienist. There is an application process, though, where people will have to tell us what their interest in their practice will be. And those interested in going and serving underserved populations, rather than just being in a private practice, will get higher points towards admission than will those who say, oh, I'm working in Saskatoon and my office I'm working in would like to have a dental therapist. They're still eligible to apply, but they will get a lower score in some of the ranking criteria.
Thank you.
I'll maybe take one more question if there is one, and I have a meeting with my boss, the provost, that I'm now 2 minutes late for, but I'm happy to do one more question if there is one. Looks like I'm off the hook.
Okay, Dr. Rothwell, I'd like to thank you very much. I've been a dental therapist for 48 years. I was one of the first, was in the first graduating class of Wascana. I know the advocacy and lobbying and significant effort that have gone into this over the past 12 years to make this happen. And from the bottom of my heart, I am sincerely happy to see this coming hopefully to fruition. I will stay tuned for the news tomorrow because it's to me, everything that's been organized, decided, the plan in place, it has addressed every single concern, issue, and very happy to see it's addressing the truth and reconciliation issues as well. And I couldn't be more thrilled. I can't, like, it's almost like a dream, like I won a lottery as a dental therapist to hear all this information. So I really do hope that it comes to fruition. And thank you for all your hard work on this and everybody's work at the College of Dentistry and anybody on the call who I know has spent decades working on this. Thank you very much.
I think I saw Charmin on the call. Charmin has put hours and hours and hours into this as well. The entire team has. So thank you, Leslie, for that. I will sign out now, and I wish you luck with the rest of your meeting.
Okay. Thanks very much. Okay, so we're going to hop back up, and Jared, you're on. You're next. Make sure we can hear you.
Can you hear me now?
Yeah,
great. Oh, it's great to be here. So thanks so much for having me, and it's been fun to work with this group and quite rewarding on the as a director for many years. lately, focus has been taken a little off on my plate anyway. Off of that a bit towards more, I think, of more of the regulatory authority type of issues that are kind of out there, specifically during this recent, or I guess during this pandemic. And so I'm going to give a bit of an update from that perspective, and but I can answer any questions on anything else. But I'll just give you a bit of an update of what we've been working on the past since we last spoke anyway. Many of you in working around the table here in regulation are aware of Bill 81. Some of you may not be. That is new proposed provincial legislation that's going to, I think the goal is to streamline applications. Well, not, I guess the processes for new Canadians, foreign trained folks, which is great. We've been doing that for a long time at the college here. It's not so much, it's not really, I look at a lot of what they're proposing, and it's a bit of interference in regulation, I guess is how I'm putting it. Again, it's not really going to affect us much here, but it just shows that governments are willing to kind of step in and override regulatory decisions sometimes. So we see that in other provinces. That's one of the first ones that kind of has hit my radar lately, that kind of shows, oh, the government here is also willing to do that. So what but before that, we have been working on just, again, strengthening our policies in the areas of registration and licensing. We, I think, have done a really good job here of that. Dr. White did a wonderful job, and Dr. Tyon and the others, and Dr. Uzak is doing a great job right now. But definitely looking at things like ethics exams, and that's not specifically just a dental thing. That's a professional thing across the board, I believe, in all professions, that lots of regulatory bodies require that as something you need to pass to be licensed. And again, that's not a criticism of our profession, or not my profession, but dentists, but just, again, generally out there, that we need that kind of stuff. I think there's some work to do in the areas of truth and reconciliation, specifically, I believe it's under the calls to action, I believe number 23, which is that all levels of government are to provide cultural competency training for all healthcare professionals. I don't see the government here maybe doing that. Nobody's telling us to do it, so we're doing it. I think we have to do it. So that might become a requirement to be licensed as well, to take a course specifically regarding some of the calls to action under the Truth and Reconciliation report. I think this was kind of sparked too by over the past, I believe it was a few months ago in February, that the first ever First Nation Health Ombudsperson office in Saskatchewan was announced. That to me also tells, that says to me that we haven't been doing a great job of that in regulation. If they need to set up ombudsperson's office, because Indigenous folks don't feel comfortable calling our organizations, or just experience that systemic racism in the healthcare, and they just don't trust. I get it, or I don't get it. I think I want to understand it, and I want to listen, and kind of focus on some of those issues. So also discipline committees, professional conduct committees, they've been, I'm not going to say busier than usual, but we have more dentists every day almost. We've grown quite a bit over the past 5 years. We almost have 600 dentists in Saskatchewan now, which is a substantial increase. I have felt, certainly. So we're just busier. Certainly in regulation, as I have kind of explained here, we have some things that we need to work on. And also with also the Act, the Dental Disciplines Act, the amendment there, we've been modifying or working on our regulatory bylaws to just reflect some of those changes. and remove some of those things that talk about oversight and that type of thing. That's not needed anymore. So that is not needed in the bylaws anymore. Yeah, so that's the kind of stuff that we've been definitely busy with. The federal health program, the announcement of the dental health, the national program, a bit of a surprise, I guess. We've seen it on the radar nationally, of course, with certainly with one federal party, and it just was not saying it's a good idea or a bad idea or anything. It just I'd never thought it would actually happen. I guess a lot of people probably didn't think that either. So anyway, we're dealing with that too. So we've been talking with the ministry here about it a little bit, but again, it's more just offering, our service, I guess, to just say, you're gonna have to figure this out. How's this gonna work? We're here to help, but we can, you tap us if needed. But the other organizations may be thinking of doing that as well. So I think that's something that's just on the radar here, even though as the regulatory authority, I'm not sure it really always matters who's paying who. It's not really, we don't get into that a ton. So I don't want to overemphasize our involvement in that, but it's certainly CDA is working on it diligently. They've been talking to our health minister, I know, for in Saskatchewan. And just again, they're kind of I mean, I think the philosophy is there that they just want to make sure that the programs are funded to a level that's appropriate. And people get kind of excited when they hear new government programs. They have concerns. I think a lot of it is due to the administrative burden of a lot of those programs on practices. I think that's maybe more where it lies. It's not so much that the programs aren't good or bad or whatever, but it's just some of them seem to have just more administrative loopholes to go through, which I get. It's public money that they're using, and I get that too. But anyway, a lot going on here, and I'm not going to say too much more than that. We have a conference coming up in September in Regina. We've been offering that to our dentists and anyone else that wishes to come. It's please check it out. You can go to our website and have a look at that if you wish. And yeah, we've been, that's another thing we've been doing here as well. We've been offering, I believe, complimentary CE here since the pandemic started. And that would be open to most, if not everyone. I think it is. I don't know if you get those notices or not across the board here, but that's another thing that we'd welcome you to join in on too. So a lot of it's virtual now, of course. And but the Regina conference of September, where it is going to be on site as it's being planned right now. So we'll see how that goes. Yeah, so that's it for me.
Okay, thanks, Jared. Appreciate that. Okay, so moving on, next on our agenda is Brenda Youngworth, Saskatchewan Dental Assistants Association update tip. Brenda's with us.
Thanks, Leslie. So we'll start out with just a few statistics from the SDAA. The membership statistics for 2021, we had 1,289 full practice members, 3 restricted practice members, 26 temporary restricted practice, and 196 non-practice members, for a total of 1,514 overall. During 2021, we had 93 new registrants, which was somewhat significant as there was no class graduating from Saskatchewan Polytechnic last year. So just a brief overview of some of our activities in 2021. We initiated regular meetings with the program heads of both the dental assisting programs, so both the U of S and Saskatchewan Polytechnic. It was a very good way to keep up on any programming changes or any other information. A great way to share amongst everybody as to what was happening and to give heads up. For the first time in 2021, we had a summer student. We applied for the summer student grant and received it. It allowed us to hire someone to assist with the scanning of a number of documents to reduce some of the paper load that we have and to help shred some of the old material. We requested another grant for 2022 and we're still waiting to hear if that one's going to be approved. With the changes of the past few years, we realized that our website needs a bit of a refresh, so watch for an updated website coming on later this year. And following up on the success of the Zoom training in 2020, we had a number of professionals recruited again to do some free PD development opportunities for our members via Zoom. The session topics that we had in 2021 were around nutrition, self-care, and different practice experiences. The majority of the speakers have been very willing to allow their sessions to be recorded so that the members would be able to view those training sessions even if they couldn't attend at the actual time. We'll continue to do this in 2022 and we're working on confirming upcoming speakers, but I believe there are a couple that have already been advertised and that we're taking registrations for. In addition, some of the things that were mentioned by some of the other regulators were, again, COVID took up a fair bit of our time. We really appreciated the cooperation amongst the other oral healthcare regulators as we worked on the whole vaccination priority process. And we are also looking forward as we move into this year, focusing on updating our regulatory bylaws for Bill 62, the amendments to the Dental Disciplines Act, and looking what Bill 81, as has been mentioned, the labor mobility changes may require us to look at. And I believe those are sort of the big pieces. Thanks so much for inviting me, and if there's any questions.
Okay, I saw a hand up. Who had a question? Who has a question? Please go ahead.
Hi, Susan Anholt. I have a question. Is the council looking at talking to government about licensing the dental aids, seeing as how there will be more in the province, and given all of the issues relative to infection control? Years and years ago, council looked at this and was turned down by government, but it strikes me that 2022 might be the year for that they would actually see the reality and the importance of it. Anyway, good luck with all of that.
Okay, so the question I believe was, is council looking at licensing dental aids? And the discussion so far has really been with Saskatchewan Polytechnic and looking at what their criteria will be. And the fact that there isn't really a dental aid licensed anywhere else in the country in any of the jurisdictions. But there are a number of other factors, looking at another piece of provincial legislation that may be coming down this year as well that will have an impact. So it's definitely on the radar.
Any other questions for Brenda? Do you still have a question, Susan? Your hand's still up, or was that it?
No, I'm good. Thank you.
Okay, so thank you, Brenda. We'll now move on to the updates from the Saskatchewan Dental Therapists Association from Cindy Reed. Cindy, go ahead.
Okay, I can't see anything, but I think I'm good. This coming last kind of makes my job pretty easy here. I'll just give you some membership statistics. We have 167 dental therapists licensed, 18 with a non-practicing license, and which gives us 185 members registered. And I just want to say we're so excited about this new program coming up. We have members of our association that are participating on some of the organizing of it, and so we're really looking forward to it, and we'll all be waiting anxiously tomorrow for the announcement. We just had our AGM, our annual general meeting, on May 1st, and we elected a new president, Mary Lou Sanderson. She comes with a lot of history as a dental therapist, working with First Nations, and we're really excited to have her. She's also isn't new to council. She's also has spent 4 years as our vice president not that long ago. I just wanted to say too, we actually had 29% of our members, our licensed members, show up for our annual general meeting. So that's actually pretty impressive. We don't have a lot of members, but it's still pretty impressive when you can get 29% of your members showing up. We also have our conference in conjunction with that on April 29th and 30th, the Friday and the Saturday. Another thing I'll mention that we had 53% our registered members attend our conference. So that's pretty impressive. The topics were oral surgery, restorations, Indigenous recourse, and that was put on by Dr. McKinstry. So that was very good, very timely, as well as bouncing forward for loss, resiliency through self-compassion. And that was John Mitchell that presented. And that was a very timely and a very good presentation as well. I guess I don't need to speak a lot about the role that the dental therapist played in COVID-19. Megan did that as part of her report. And I just can't say how proud I am of our profession for being able to play such a vital role in helping with the COVID-19 cause. And going down my list, Alyssa had mentioned the Health and Wellness Day that was in Regina, as well as the next Health and Wellness Day that's going to take place at La Roche and Clearwater Reserve. Several dental therapists have participated in the past and will be participating again, so I won't go into detail about that. The Dental Therapists Association also has established an internationally educated dental therapy program. We're doing this in conjunction with SASPOLI, SAS government. They're all helping with that. We have a pilot project coming up, so we're doing just pieces of that. We actually have a clinical assessment coming up, and we'll have a couple people have applied for that and have been accepted. So we're kind of excited about that. There will be some gap training courses that dental therapists will need to take, and SASPOLI is helping us with that. Some of them are like stainless steel crown, rubber dam, courses like that. In the end, if they pass all the stages of the internationally educated dental therapy program, they'll be licensed with restrictions in the province, and we'll need to enter our mentorship program. The mentorship program was developed several years ago. Also, I just wanted to mention too, with Canadian Dental Therapists Association, we don't have a strong membership across the country for dental therapists. So our Canadian Dental Therapists Association has been kind of run through our association. So, and it's really been a good tool for communicating with dental therapists across the province or across the country. So we'll keep expanding that, and our mandate on that will just keep, like I said, keep expanding. So, and at council, we're working on defining a little more, getting a little bit more defined job descriptions of the executive director, the registrar, treasurer, secretary, those type of positions, because we may need to be replacing somebody and putting a new person in those positions. Also, we're also working on modules for our members. Space Maintainer module is something that has been offered over the years, but it hasn't been offered for a number of years. It's kind of taking a little bit of a different format, just because most of our members, I guess Dr. Brothwell might consider us all mature members, since the last members graduated in 2011. So we're also working on ethics and jurisprudence model, cultural awareness models, those types of things. And at some point, they probably will become mandatory for our members to take, but they're definitely going to be mandatory for new members of our association at this time, as well as IPC course through SASPOLI as well. Our website as well is being updated, and we've been working on that for a while. And the last thing is, in 2024, that will be 50 years of dental therapy. So we're planning on celebrating that in Saskatoon in 2024. So everybody can look forward to that. And that's my report. Thank you. Any questions?
Any questions for Cindy? Okay, hearing none. Thank you very much, Cindy. That was very interesting. And we'll move on now. Saskatchewan Polytechnic update, and I believe Deidre Anderson-Dahl is doing this. Please go ahead.
Hi, everybody. I have slides, so I'll just bring them up here. Can everybody see that? Yeah, awesome. Okay, so on behalf of the dental programs, my name is Deidre Anderson-Dahl, and I'm a dental hygiene instructor, and I am the interim program head for the academic year. So we're thankful to be given the opportunity to develop our relationship with the Sask Oral Health Coalition, and it's wonderful to hear how many partnerships we already have going on just from all the other reports. So some highlights from the dental programs. There's lots of innovation and flexibility that has happened over the last few years during the pandemic. As many of you have experienced the word pivot, which we use more often than we have in the past. So we're continually adapting and changing to ensure student success. This year, we were fortunate enough to welcome back the dental assisting program as they were on pause for the academic year last year. So we're really happy to have everyone back on site. And as you can see from these pictures, we have a lot of fun together. And this year's theme for Halloween was Under the Sea. The teams were also welcomed back to a newly renovated dental clinic, which you have heard about already. So the next few slides are just some pictures of the new clinics. As you can see, we're really fortunate enough to have amazing views from our spaces, but even just within our operatories, having the surgically clean airs, the new equipment, and even from when this picture was taken, we now have stationary computers in each clinic or each operatory as well. You saw this picture already just for our centralized dispensary area, which provided the correct contamination to sterilization flow. The dental hygiene program was approved for curriculum revisions this year to help sequence our learning outcomes for better student progression and understanding. As well as the new national entry to practice standards were introduced this past winter. So we're busy working on additional updates to align with those new revisions. Tomorrow night, we are hosting our first dental specific career day. Students will have an opportunity to network with future employers, including private offices and corporations, and they potentially could walk away with a job offer. So we're looking forward to continuing this initiative in future years as well. Community involvement is a big part of the dental program, so we're really excited that this year we're able to do more in-person partnerships again, as with the last couple years, we've pivoted mostly to Zoom. So many different opportunities for the students to get out there and help with oral health. These projects allow students to spread dental knowledge and serve their community. And the one big hit this year was a CCA, Continuing Care Aid Program Interprofessionalism, where one of our hygiene students put on a clinic where she taught the CCA members about oral health and how to work with that out in practice. You guys heard about this already. We resumed our Oral Health and Wellness Day. We hosted 130 dentists, dental therapists, denturists, dental assistants, hygienists, nurses, and SAS Polytech students, faculty, and staff. So we did complete a little bit over 43,000 worth of dental work, and it really, without the sponsors and the volunteers, this day wouldn't happen. You've heard already that we are planning our Northern Health and Wellness Day to take place in the fall of 2023 in the communities of La Loche and Clearwater Dene Nation. So we look forward to this partnership and hoping to have students have a chance to serve in the North as well. This year began work on a dental assisting online development program. Classes are being developed into a hybrid model where the primary theory portions of the course will be completed online by the student, and then the student will come to campus for the hands-on portion, all while being affiliated with a private practice office. So work on this program development will continue next year. Cindy talked about the pilot dental therapy gap training program, where dental therapists from other countries completed training to have their credentials recognized, or it's upcoming, I should say. And a big thank you to the SAS Poly dental therapy instructors for all their hard work that went into making this project a reality. And then you also heard from Dr. Bothwell just about the dental therapy program. So we're looking forward to having this program join SAS Polytech. And just a big thank you for the opportunity to share what we've been up to this year.
Thank you, Deidre. Any questions for Deidre? That was a nice presentation. Thank you. Any questions? Okay, thank you very much, Deidre. We're all up to speed now on what's been going on there for the past year. That's great.
Thank you.
We're going to move on now to update from the College of Nursing at the University of Saskatchewan from Marcella Ogunchuk. I believe she's, are you going to spotlight her?
Good morning.
Good morning.
All right. Thank you for the opportunity, Leslie. It's been a great learning experience listening to everybody's updates, and look forward to bringing that back to the College of Nursing. My presentation will be brief. As working through the pandemic, most of our clinical practices have changed previously. Right now we have a new dean, Dean Selena Richter, who is getting up to speed of what's going on at the College of Nursing. So I'm going to, I think, take a little bit of a perspective, as Jared did, is about what we're doing right now and maybe the direction we need to be going in. And so right now, there is ongoing teaching about oral health in all classes. And so where I think we need to look at in the future is what exactly is being done, how much time is being presented in the classrooms towards adult as well as oral health in children. The feedback I'm getting when I'm in clinical is that our nursing students still have very little education on oral health. In our own pediatric clinical groups and in the theory, we do have usually around a 2-hour lecture towards pediatrics, oral health, and also in the clinical area. However, we do know that in the acute care clinical area, there is not a lot of teaching done to parents as an outpatient basis towards oral health. Moving on to research, I know that colleagues of mine have published papers on manuscripts on the importance of oral health in pediatrics specifically. And personally, in the group I'm working with, we are just completing a project, and we have completed a book or a booklet for oral health professionals. I just have it here. I know it looks blurry, but I can send a link to it. It can be downloaded, or it can be picked up at the community or at the University of Saskatchewan bookstore. It was made to give to family members to prevent early childhood caries, and it's given with a little toothbrush to help them to inform new mothers of early cleaning of teeth. And so this is a hard copy, or else it can be downloaded. It is translated into Dene, and there's one is just being translated into Cree, and the one in Dene is also read in voiceover in a PDF format. We're just trying to get it into a format that people in the community can listen to as well. And so I think that sort of completes my ideas, and I look forward to, Leslie, to maybe get some feedback as to my ideas as far as getting specific information of education being done within the College of Nursing. And I'm also looking forward to partnerships such as Sask Polytech's partnership with nursing in providing oral health to communities, specifically into rural or remote like La Loche, because we do have a presence there already, and with our pre-professional year. Anyway, I think that completes it. Thank you so much for this opportunity.
Thanks, Marcella. Any questions for Marcella? So Marcella, will you send that link to Lena Enz and myself, and we'll make sure it gets out to the participants so that we can all have that information, please? It sounds very good. I know we have a book called The Walk with Charlie Chu that there's been discussions about having it translated into a variety of languages, but we haven't got that far yet, but it's a really, really good idea for sure. Okay, so thank you very much. So moving on, so I guess I'm kind of the last presenter, and mine will be brief as well. Just to update on the Saskatchewan Health Authority, and there are a few other people that are on right now that are from the Saskatchewan.
You're on mute, Leslie.
Okay. Can you hear me now?
No. No.
I can hear you, Leslie.
We can always hear Leslie.
I can hear her. I can hear you.
Yeah, it's on your end, Kelly, I think.
Can you hear me now?
Yes.
Yes.
Okay. All right. There we go. So there are other people besides myself on.
I'm trying to see if I can unmute you.
Okay, but people can hear me apparently.
We can hear Leslie all right.
So anyways,
Yep.
I'll proceed.
I can hear you now.
There are other people on for the Saskatchewan Health Authority, so I'll just kind of give a very brief, broad overview and talk a little bit about some Saskatoon specific. And then if other people from other areas in the Saskatchewan Health Authority want to jump in with additional information, that's fine. I think we talked about our update in 2021 that for the most part, from March to July of 2020, everything was in lockdown and there were no dental services provided. And we really made the big jump during that period of time to work remotely for the most part. By July 2020, in Saskatoon, we actually opened both of our public health dental clinics, and we were back into working into long-term care and doing fluoride varnish. But and some areas did also do fluoride varnish at that same time. But most people in dental programming in SHA were deployed. So most of them were either doing, taking on either leadership roles, acting at management roles, doing administration, or actually doing testing. Many of the dental assistants were doing testing, and they were quite valued in those positions. But anyways, by March 2022, just recently, when the letter of understanding was dropped that the government needed to have the ability to redeploy the labor force as they saw fit, then everybody went back to their positions and services have resumed. And so it really is like starting from scratch to resume a lot of the services that you were doing 2.5 years ago. And there's a bit of a learning curve to that. In Saskatoon specifically, the biggest update I think is work on what we call the City Centre project. And if you watch the news, you may hear about it under a variety of names. It basically is the rebuilding of Princess Alexandra School, which is on the corner of Avenue H and 20th approximately, or 22nd, sorry. And it's going to be a brand new school. It will have the students from Princess Alex, King George, and Pleasant Hill in it. They expect a student body of around 700 students, and all the amenities are being planned accordingly. It will also have a building built to the south of it that is connected to the school. Probably, they don't know for sure yet, 2 to 4 levels. And it will include a lot of the Saskatoon Tribal Council offices and many other community agencies and groups. We do know that, so right now SHA does run and manage the White Buffalo Youth Lodge Dental Clinic that is in White. From within the White Buffalo Youth Lodge will be redirected and rolled into the programming that happens out of this new, for lack of a better word, City Centre project. And that will include 2-chair operatory. That one of those will be for White Buffalo Youth Lodge. The other one will again be managed and under the jurisdiction of the Saskatchewan Health Authority, our dental public health program. So we look forward to that. The school, it will I think it's supposed to be opening in 2025. And so I guess stay tuned, there'll be more announced on that, but it's quite an exciting project. And from that, do any of my other colleagues, Patricia, did you want to say anything? Jen, Lori, or other people that are on from SHA, do you want to step in and do an update on your area, or are you fine with what I've said?
No, I'm fine with what you said.
Yeah, I am too. It's Jen. I think you covered all of what my notes read here.
Okay. Okay, so that's pretty much it from an SHA perspective. We're all quite excited to get on with resuming our services and move on in that direction, because a lot of the school-based services really haven't been in school since March of 2020. So people are very excited and happy to get back into that work. And I think, are there any other questions or comments that people have? Because we are at the end of our agenda for today. Okay, hearing nothing, we will adjourn, and I guess stay tuned to the news tomorrow. Maybe there'll be some, decades in the making news announced tomorrow. I'm quite excited about it. So stay tuned, and thank you very much for your participation. And we'll go for now. Thank you.